Hi, I'm Bernice, the spinal practitioner in the neurosurgery spines team. After a cervical spinal decompression and fixation, the key is to get patients eating, drinking and back on their feet as soon as possible. This is to reduce stiffness, improve function and prevent other complications following a general anaesthetic, such as deep vein thrombosis and pulmonary embolism. Usually, these operations only require a 1 to 2 night stay in hospital, and once you have recovered from the anaesthetic and have been reviewed by the surgical team, you'll be able to continue your recovery at home. Surgeries that require access from the front of the neck may cause some changes in swallow and voice. For a few days after the operation, you may experience a quiet, hoarse voice and some difficulty in swallowing. We recommend eating softer foods for a few days, as solid foods may cause some pain and discomfort, and sometimes you may want to double swallow or chin tuck to ensure the food goes down well. Patients often report a lump in their throat after the operation, and this is quite normal. However, if you experience any discomfort or feel that you are choking on your food or drinks, please stop and report it to your nurse. We may have to get you assessed by the speech and language therapist to ensure that you are not at risk of aspiration, as people can get pneumonia if they aspirate food and fluid into their lungs. Once you have been discharged from hospital, if swallowing and voice problems continue to arise or you experience chest infections or unexplained weight loss, please contact your surgical team or your GP to make a referral to the community speech and language therapist. At the time of leaving hospital, you'll be told what dressing was used. If it was steri strips or paper tapes that go across your skin, this can be removed by yourself after 7 days, normally after a shower. If you have any concerns, feel free to book an appointment with your GP surgery for assistance. In some instances, a stitch or staples are used, and if so, you'll be given a clip remover and advised to book an appointment with your GP surgery in 7 to 10 days as per your discharge letter, so that they can remove them for you. It's best practice not to touch the wound dressing for 48 hours to prevent surgical site infections and promote wound healing. When the wound heals, you may notice a lump where the skin has been sewn together, and this is quite normal, and the hospital will check the wound before you leave to ensure that there is no further bleeding. They will also apply a waterproof dressing. However, this isn't foolproof, so your nurse can give you some additional dressings to take home. We advise you not to have a bath for 1 to 2 weeks after your operation. You can have a shower, but please do not splash water over your face and neck, and if your dressing gets wet, please change it immediately. The dressing might feel itchy and can cause discomfort when hair around the area starts to grow back. If you feel it is stretched across your neck, you could always ask your nurse to change it. If you see a soft ball-like lump and begin to suffer from a high temperature, headache, neck pain or difficulty seeing lights, please report this to your surgical team. You'll be contacted around 1 to 2 weeks after the operation to see how your wound is healing. After the operation, you can continue to experience your pre-operative symptoms as well as post-operative discomfort. Operations from the front of the neck tend to be less painful, whilst those from the back can be quite painful across the shoulder blades and neck because the muscles have been stretched during the operation. Please remember to take your regular analgesia for the next week or 2 and slowly reduce them if your pain has improved. It is important to do this as your neck will be sore for some time. The usual recommendations are for paracetamol, codeine or tramadol at this stage. After a gap of 2 days, you may take some non-steroid anti-inflammatory medications such as ibuprofen or naproxen if it has been prescribed to you. And in some cases, your surgical team may give you stronger opiates. The neuropathic painkillers such as gabapentin, pregabalin, or opiates such as tramadol may be continued and slowly tapered off to avoid any withdrawal effects. 1 tablet at a time, 1 dose at a time, in a gap of 3-day intervals. After your operation, you will notice that the pain usually resolves sooner, but numbness or pins and needles can take longer to resolve, if at all. This will be discussed and explained to you by your surgeon at the time of consent. If your operation was in the front of your neck, you will have a routine X-ray after the operation to check alignment and positioning. As a routine practice, we do not advise collar use after anterior or posterior cervical surgery. Your consultant might make a decision after your operation to apply one for added support, and you'll be given clear instructions on how long you will need to wear it for and how best to manage this. A physiotherapist may see you prior to discharge if you are admitted into hospital during the week. They will assess your mobility, posture and muscle strength and will inform the medical team if they feel you are safe for discharge. The physiotherapist can offer you advice on certain exercises to help maintain or improve your posture, range of movement, strength and function, depending on the type of surgery that you've had. Please maintain a good posture throughout your recovery phase and make sure that your head and arms are well supported when sitting. Likewise, please avoid looking up and down, twisting and heavy lifting activities for up to 4 to 6 weeks. The guide in terms of lifting is about a kettle full of water. Whilst performing any domestic activities, please avoid anything that puts a strain on your neck and back and always maintain a good spinal alignment. You may drive after 1 to 2 weeks if you feel safe to be behind the wheel, able to turn your head and do emergency stops. Please refrain from any contact sports and leisure activities such as Pilates and yoga for 3 months until your neck has had a good opportunity to heal internally. You may return to work in 3 to 4 weeks depending on the type of work that you do, and if it involves heavy lifting then you may need a sick note for around 6 weeks and may need a reassessment by your GP. These are all rough guides and the general rule is to listen to your body. If it hurts, step back and slowly work your way up. Your surgical team may arrange a follow-up by telephone or in person somewhere between 6 and 12 weeks, depending on their practices, and this will be documented on your discharge letter. You will need this time for your neck and arm pain to settle and for the nerves to start to heal. Numbness takes a long time to resolve, if at all. If your arm pain gets worse, please contact your surgical team. We have a dedicated advice line that you can access Monday to Friday, 8 AM to 4 PM to support you with any questions or queries before or after your operation. To summarise, most patients do very well with these kinds of surgeries in the medium and long term, and we anticipate short stays and early mobilisation as the key to optimise recovery. Details of your spinal diagnosis, operation and outcomes will be recorded on the British Spine Registry, and this will be discussed with you. You'll be asked to contribute to this by completing questionnaires at different stages of your recovery.